All right, so first up we have to talk about partial pressure. I know many of you have heard this before, but it is often a dusty concept for folks. So I always talk about it very specifically in the respiratory chapter. So when we talk about solutes in solvent, we use the idea of concentration, right? Solvent over solute. This is inconvenient for gases because gases can come out of solution and go into solution very readily. So instead of using concentration as the measure of how much gas is in a collection of gases, we use partial pressure instead. All right, so some examples. We'll talk about air. So air is 19% oxygen, 81% nitrogen. Okay, I've rounded some things, but that's good enough, right? Okay. So how do we, so that is a ratio, right? 19% so 19 out of 100, 81 out of 100. All right, so that's another way of describing concentration. But that doesn't help us very much in determining concentration or diffusion gradients, okay? So if we take the total air pressure, which is 760 on a normal day, today it's probably a little lower than that because it's cloudy out. But if we take that total pressure and we multiply it by the percentage that that gas represents, so 19% is oxygen, 760 is the total, 760 times 0.19 is 144. So that is essentially the concentration of oxygen in air, right? So it is serving the very same function as grams per milliliter, okay, only it's a molecular ratio instead because of how gases are complex. We can do the same thing with nitrogen. 760 is the total, it's 81%, so that gives us 616 is our partial pressure of nitrogen in the air. All right, so instead of talking about concentration as we talk about gases moving, we're going to talk about partial pressure instead. And the way that's usually represented, little p and then the molecule involved. So like little p O2, little p CO2, and that kind of thing. Now, it is a concentration measure, which means that diffusion still happens, right? So gases are going to move from areas of high partial pressure to areas of low partial pressure, just like diffusion moves things from high concentration to low concentration, okay? And ultimately, it's that pressure gradient, that concentration gradient, that's going to move oxygen into the blood and into the tissues, and CO2 out of the tissues and out of the body, right? Out of the blood. Okay, so when we dissolve a gas in fluid, okay, the partial pressure is also affected by the solubility. This probably will be familiar from general chemistry too. So oxygen has a solubility of 0.024, CO2 0.57, nitrogen 0.012. You don't have to know the numbers, okay? I do want you to know that CO2 is 20 times more soluble than oxygen, which means, essentially, CO2 is very comfortable living in a fluid, living in our water-based system. Oxygen is much less comfortable in that situation. In other words, blood, let's talk not about blood yet. Water can carry a lot more CO2 per unit volume than it can carry oxygen because of the solubility difference, okay? And we'll see why that matters. The single biggest reason it matters, this fact that oxygen isn't very soluble, is why we have hemoglobin, okay? Because without hemoglobin, we would literally not be able to carry oxygen around the body in sufficient amounts. All right, so the way solubility works with partial pressure is that if we take the same amount of gas in a solution, the more soluble gas will have a much less partial pressure. Now, in truth, these are chemistry concepts. Thankfully, we're not going to use them beyond diffusion gradients, okay? So all you really need to know is high partial pressure to low partial pressure is diffusion, all right? This is just the chemistry background to it in case partial pressure is something you've never heard of. All right, so if we start at the mouth and we go all the way to the alveoli, we're going to see that the characteristic of the air in the lungs changes. Okay, so first off, air in the room. Air in the room, very high in nitrogen, very high in oxygen, very low in CO2, and of course there's water, right? Remember that the water concentration of air varies tremendously according to your environment, right? You know, if you're in Las Vegas compared to Omaha today, right, you're going to have a significantly larger amount of water in the air here. All right, so that's room air, as I like to call it, the air the planet makes. Now, if we humidify that air, in other words, we pass it through the nose, right, because that's what the nose is for. The nose humidifies and warms the air, okay? So as the air, by the time the air is in the trachea, it looks like this. So what do we have? We have a little less nitrogen, we have a little less oxygen, because we have a lot more water. Do you see that? So essentially the water has displaced the oxygen and nitrogen. You'll also see that the CO2 hasn't changed because there's no gas exchange in the nose. So like the body isn't adding CO2 to the air in the nose, right? Because the walls are too thick. Now, if we get down to the alveoli, we see pretty significant changes. Our nitrogen doesn't change very much, and remember, nitrogen in the body is inert, right? The only time it's not is scuba diving, and I'll tell you about that another day, right? The bends, okay? But typically, on the surface of the Earth, nitrogen is neutral. It doesn't do anything. But the oxygen, of course, does. So if you compare alveolar air to atmospheric air, you can see that alveolar air has much less oxygen and much more CO2. Why? Because we're stealing oxygen out of it as blood goes by, and we're delivering CO2 to the alveolar air as blood goes by, right? Now, what about on the other end? So this air eventually has to get out if we're going to have an effective exhalation. So the air that comes out of the human being is also different than the alveolar air, right? So we see that the oxygen is higher. Now, stop and think about that. Does that make sense? The oxygen you breathe out has more oxygen in it than the alveolar air does. The idea is why? Mixing through the dead space, right? Remember, we have these air tubes that have essentially humidified air in them. As we breathe out, the air from the alveoli gets mixed with the air that's coming in, right? So it means that our expired air gains a little oxygen from the alveolar dead space. And if we look at CO2, the CO2 is a little lower in expired air than it is in alveolar air, again, because of the mixing with dead space air. Dead space air looks like this, very, very low CO2, right? So we're mixing this air with high CO2, and we're getting somewhere in the middle, okay? And then the water, you can see, is pretty much the same all the way across, because we don't dehumidify the air until it comes back out through the nose, and frankly, we're not good dehumidifiers, okay? We lose a lot of water into the air. We do better at humidifying air than dehumidifying air. There are animals that do this much better. I like to talk about the desert animals. When they exhale, they have much less water in their exhalation because their nasal mucosa is so exaggerated that it literally pulls the water back out. So it looks more like that. Okay, so changes from mouth to alveoli and back, and why.